This is the fifth video on acid reflux and will discuss endoscopy. The doctor could arrange for early investigations and in particular endoscopy during the first visit in 5 categories of patients. If the symptoms are severe and severely affects the quality of life. Secondly, the doctor might suspect that the patient might have complications of acid reflux. Thirdly, there is a need to rule out other conditions that may present like acid reflux. Examples would include stomach disorders, heart disease, gallstones. Fourthly, the patient has alarm symptoms. And lastly, the patient is at high risk of Barrett's esophagus. The doctor might also suggest investigations at a follow-up visit if patients who have symptoms of uncomplicated acid reflux do not respond to a 4 to 8 weeks course of medication like PPI. The main investigation that is done in patients with acid reflux is endoscopy, where a thin, flexible tube is passed from the mouth into the esophagus. Endoscopy of the esophagus, stomach, and upper small intestine is called esophago-gastro-duodenoscopy or OGDS in short form. This slide shows an image of how an OGDS is done. What additional information can the doctor learn from endoscopy? There are 4 possible findings. The endoscopy could be normal, which is good news for the patient. This shows that even if there is acid reflux, there is no evidence of damage to the esophagus. The medical diagnosis for patients with acid reflux and a normal endoscopy is called non-erosive reflux disease or NERD as an abbreviation. The endoscopic findings could show tiny breaks in the lining of the lower esophagus. These are called erosions. If the damage to the lining is deeper, then an erosion is called an ulcer. This indicates more severe acid reflux with inflammation. Both erosions and ulcers confirm that the patient has acid reflux. The medical diagnosis for patients with acid reflux and erosions or ulcers is termed reflux esophagitis. This images shows you a normal esophagus on the left side and erosions in the lower esophagus on the right side as indicated by the arrows. This image shows ulcers in the esophagus and this patient has got severe reflux esophagitis. Thirdly, the endoscopy might show lesions that are unrelated to acid reflux, like disorders of the stomach, for example, gastritis, and ulcers in the stomach and duodenum. The duodenum is the first part of the small intestine. Fourthly, the endoscopy findings might suggest serious complications of acid reflux, which I will discuss subsequently. There are 3 serious complications of long-standing untreated acid reflux. They are Barrett's esophagus, which is precancerous. On the left is a picture showing you how a normal esophagus looks at endoscopy. On the right is a slide showing you how Barrett's esophagus looks at endoscopy. The salmon-colored looking mucosa or lining is Barrett's esophagus. The second condition is called esophageal stricture. A stricture is narrowing at the lower end of the esophagus due to scar tissue formation. This happens when ulcers caused by acid reflux heal. The scar tissue is similar to the white scar tissue that forms when a cut on your skin heals. The picture on the left shows a normal esophagus, while the picture on the right shows how a stricture of the esophagus looks at endoscopy. You can see the narrowing, which is labeled by arrows. Patients with stricture present with difficulty in swallowing because the lumen of the esophagus is narrowed. A third complication is cancer of the esophagus. Fortunately, it is rare. Cancer of the esophagus may develop after many years of chronic acid reflux.